Well, happy Friday there, folks. Brian Nichols here on The Brian Nichols Show. Thank you for joining us. Yes, I am your humble host. And by the way, you get to hear me again because you heard me last episode here on Thursday, Chris G. He was busy, so we didn't have a marketing solo, but you did get to have a one-on-one with yours truly. And we talked about how do you become that trusted advisor. Hint, hint, less is more. Want to learn more? Go back and listen to yesterday's less than 10 minutes episode, I think it was. So with that being said, on to today's show. And today's show, we are having an amazing guest, one Dr. Murray Sabrin. Now, Dr. Sabrin's coming on the program to talk about, what's this? The universal medical care from conception to end of life. It's a new book he just wrote. And if you're one of our libertarian, conservative, or Republican listeners, you might be a little skeptical. Don't worry, all your questions will be answered. Just stand by, I promise. So, with that being said, on to the show. Dr. Murray Sabrin here on The Brian Nichols Show.
Thank you, Brian. It's great to be with you.
It's great to have you, Dr. Sabrin, and we're going to be talking about your brand new book today. I'm so excited. It is Universal Medical Care from Conception to End of Life. Now, right off the bat, we were talking beforehand, your average person hears this and they go, this sounds like an interesting topic for a libertarian-leaning podcast, but Dr. Sabrin, you did something very sneaky in the way you titled your book, because you're appealing now to an entirely different audience who's going to be getting maybe not what they bargained for. But before we get there, let's introduce you to the Brian Nichols Show. Who are you and what got you looking into healthcare policy of all things?
Well, last year I retired after a 35-year career as a professor of finance in the Annisfield School of Business at Ramapo College. And before that, I worked at the American Institute for Economic Research for a bit and worked in commercial real estate in northern New Jersey. So I have a background in finance, even though my PhD is in economic geography on the geographic aspects of inflation. Murray Rothbard was an outside member of my dissertation committee while I was studying at Rutgers. And I'm only one of two people in the history of the world who's had Rothbard as a member of a dissertation committee. So I started my career as a New York public school teacher. And I wrote in 1995, the book was published, Tax-Free 2000, How to Create a Tax-Free World that would put responsibility on people to generate their income and spend it as they see fit, and have the government take a minimalist role, either a la the Constitution, but without taxation. In other words, have an association of individuals and the government based upon fees and other things, or just privatize everything. That would be another option. In other words, a totally non-governmental approach to a functioning society. And then 2 years ago, my book on the Federal Reserve was published, Why the Federal Reserve Sucks. It causes inflation, recession, bubbles, and enriches the 1%. And of course, we've seen that happen since the Federal Reserve was created in 1913. And so this book is my third book. I have another book coming out next month called Navigating the Boom Bust Cycle, an Entrepreneur Survival Guide. And then I'm beginning to write my next book that'll be published next year, and that's on medical insurance in the workplace. So since I retired a little over a year ago, I've written two books, starting my third book. And hopefully this book, particularly on medical care, will have an impact, because it is the 800-pound gorilla in the room. Medical costs take up nearly 20% of the American people's income. And of course, the way it's structured today, it's a hybrid system of taxpayer-funded programs like Medicare and Medicaid, third-party payers paid by the employers with insurance companies. And one of the themes of the book is that we're overinsured, we're don't have good nutrition, and therefore it's causing all these problems in medical care. And what I do in the book is something that I don't think anyone else has done. I differentiate healthcare from medical care. Healthcare is the responsibility of that person you look at in the mirror every morning. You are responsible for your healthcare, not the president, whoever that may be, not the governor of your state, not the mayor, not Dr. Fauci, not the head of the CDC. You are responsible for your healthcare. And I learned that lesson a long time ago. So I've been doing what makes, I think, for a healthy life: eating right, getting exercise, taking the proper supplements, hydrating. and having hopefully good genes that will give me a long life. Both my parents made it to their late 80s, and they didn't have the greatest nutrition. They barely survived World War II in their native Poland. So, given what I learned about nutrition and healthcare and medicine, why is a finance professor writing a book? Well, ultimately, it comes down to who pays for medical care. And why people think medical care is a right is beyond me. Since I became U.S. citizen in 1959, I raised my right hand to defend the Constitution, and I couldn't find anything in the Constitution then or since then that the federal government is responsible for our medical costs. There's nothing in the Constitution that authorized the federal government to be involved in one of the most personal, intimate relationships we have, the doctor-patient relationship.
Well, I think we're recording here today on Thursday, and this episode's airing tomorrow being Friday. So everybody just heard how in depth Joe Biden really wants to be with your personal medical decisions, but we'll talk about that later. But going back to something you discussed, and I was writing down some notes here, the idea that we are overinsured and undernutritioned. That's so profound. And I tweeted this morning because I went back and re-listened to your appearance over on Tom Woods. And you had said that as well, the healthcare versus medical care. I started out back when I graduated from college. I got into PR and marketing for physical therapy and fitness facilities. And you do see that there is that very fine line of people who they look for just the medical answer versus taking almost preventative steps in that proactive approach to trying to take care of yourself. And we see this abdication almost of personal responsibility to not just other people, but to this nanny state government. And now for your person who's listening to the program and they first heard universal medical care, what? Now they're starting to see it's coming together. This isn't a top-down approach to medical care, but rather we're going to go ahead and remove the top of this entire entity and start focusing bottom up, the patient-doctor relationship. So Dr. Sabrin, let's dig into that to start off. I know that's one of the overlying themes of your book is going back to this relationship with the actual doctor, not this faceless organization that you get assigned a doctor and they see you once a year and then patch in the back and have you on your way.
Yeah. Well, this is, I think, the sad reality of the evolution of medical care since when I was a youngster back in the 1950s. And when my parents took me to a doctor, and I think my first visit to a doctor, I believe, was in 1955. Why do I remember 1955? Because that summer I broke my arm in the Catskill Mountains when we were on vacation for the summer. And I came back in a cast. And no, in fact, the cast was taken off before I came back to New York City. And I visited my family's pediatrician. My younger brother was seeing him, and so I went to see the doctor, and it was $5 for the visit. And then it went up to $7 and then $10 because of inflation and so on and so forth. But the point is, that was direct payment. There was no insurance for my parents to pay for doctor's visits. And if we needed an antibiotic, we went to the local pharmacy and we paid a few dollars for an antibiotic prescription. So there was no insurance for that. My father had a major operation in 1961 when I was graduating junior high school. And I recall Blue Cross Blue Shield took care of the bills. I don't remember my parents saying this is going to break their bank, so to speak, their savings for this operation. And from what I recall, it was a fairly modestly priced operation in one of the top hospitals in Manhattan. And so that's my framework of what medicine was all about. And then that fateful day on July 30th, 1965, when President Johnson signed into law Medicare and Medicaid. And ever since then, medical care has been distorted with HMOs, health maintenance organizations. And the way I look at medical care, it should be a four-legged stool. One is direct primary care, which is growing across the country, where doctors have a fairly low number of patients. The typical doctor in a typical partnership or a corporate physician setting usually has about 2,000 patients. In direct primary care, they usually have between 800 and 1,000. So they can give you more time in the office to diagnose your problem and to recommend the course of treatment. And you have access to the doctor virtually 24/7. You pay a monthly fee. It's very modest. And there's no insurance involved. You pay that. So that would be the first aspect of everyone getting a direct primary care physician. And if you can't afford that, then you have the stores like CVS and Walmart, and I think Walgreens are establishing clinics in their in their stores all across the country. So there are thousands and thousands of stores that can provide primary care to people who don't have the ability to pay for that $80 to $100 a month per person, or $150 to $200 per family, which is pretty modest when you think about all the benefits that you're getting. Plus, they do provide testing at a very modest cost also, which you can pay out of pocket. So you don't need insurance for that. Then for people who don't have any means, in other words, people who are on Medicaid today, which costs the taxpayer $600 billion a year, how do we get rid of that $600 billion price tag for Medicaid? And that is what I've been involved in northern New Jersey when I lived there. We're now in Southwest Florida, is the volunteers in medicine model, where medical professionals get together, open up a facility, rely on voluntary contributions, and provide medical care at no cost to people in the community who can't afford it. This was started in Hilton Head, South Carolina, in the mid 1990s by Dr. Jack McConnell, and he passed away a couple of years ago. And they're thriving all across the country. So we have that model for low-income folks who really can't afford direct primary care, and so you have that model for helping people who are on Medicaid today. What would be the next thing? I would say we have to have these super health savings accounts where you put money in tax-free, they grow tax-free, you take it out tax-free to pay for the big expenses. And that could also pay for catastrophic insurance policies. So you have all the infrastructure in place. All we need is a transition, including Medicare, transitioning people out of Medicare, especially wealthy people who can afford to buy their own policies without subsidies by working folks. And young people can start putting money away in a super health savings account that will be part of their retirement package. So when they do retire, they do have the funds to purchase any type of medical care they need, including long-term care. They have policies for that as well. So it's all about cash payment. It's all about using insurance sparingly for the big ticket items, such as a heart operation or long-term cancer treatment. But in a free market, those prices would come down. And the best example of this is a story I heard at the Free Market Medical Association conference last month in Texas, when I was speaking to a corporate executive whose company decided to do direct payment, and they got a truck to come to their company parking lot to do MRIs, and the charge was $400 per MRI. That same truck went down the street to the hospital, and the hospital was charging $6,000 for the same MRI. This shows you how overcharged the medical care is in the United States. And the co-founder of the Free Market Medical Association, Dr. Keith Smith, he has the Surgery Center of Oklahoma. They're a cash-only operation, and they provide quality medical care at a fraction of the price of local hospitals. I'll give you an example. One of the doctors I interviewed for my book on universal medical care is a direct primary care physician in Fort Myers, Florida. I called her up. We had a lengthy conversation, and she told me about a patient who didn't have insurance. He needed an operation. The local hospital quoted him, I think, a price of $20,000. She got him in touch with the Surgery Center of Oklahoma. He called them up, and the whole operation, including transportation and staying in Oklahoma for the operation, was $5,000, which he paid out of pocket. So it shows you. So it shows you the free market drives down prices for consumers and provides quality care. And that's just one example of what's happening across this country, where doctors and patients and companies are using the free market to deliver quality care at a fraction of the price that insurance companies are paying hospitals and doctors for through the current traditional third-party payer system.
That's just astonishing to hear that number, because that's just, you can't even think to like just have that bill come in just because. And this goes back to, I think, another part of your book that you raise up is we have this weird relationship between our employer and our medical insurance. Now it's
Right.
entirely on purpose, but we see that too often that becomes now the way that a lot of people perceive what the problem with healthcare is. It's not a matter of these costs, but it's just, well, I don't have the right job. I need to get a better job with better health insurance. But to your point, it's the fact that the health insurance is so overinsured that's actually causing a lot of these problems to begin with.
Well, this is the sad situation. We know that the linking of medical insurance with work started big time during World War II when companies were prevented from raising wages because of wage price control. So what they offered is a non-tax benefit called medical insurance. And so that began the linkage of medical insurance with the workplace. No other insurance is linked to the workplace. We don't get auto insurance through the workplace. We don't get property and casualty, homeowners insurance, life insurance through the workplace. That's all done in the private market, and it works very effectively and efficiently. No one is complaining about the lack of insurance in those areas. And so we need to go back to that model where we only need insurance for catastrophic losses and we pay out of pocket, which will reduce the cost of insurance dramatically. I mean, for a family of four, the typical policy, I think, is $20,000. And that is a lot of money, especially if you're a healthy family. You're not getting any benefit from that. So wouldn't it be better to, let's say, pay $5,000 for a catastrophic policy and pocket the 15,000, put it in a health savings account, have it grow, and use that money over time to pay your bills? And now you have a direct relationship with the doctor in terms of buyer and seller. In other words, using the approach that we use for other goods and services. Healthcare is no more a right than cell phone service is a right. Uh, Medical care is something that you contract somebody, a professional, with in order to achieve a goal, which is better health, optimal health. And so there's no reason to have insurance pay for that. And the other point that needs to be stressed is, given that we now have the ability to see prices transparently, the internet should allow every doctor, every surgeon, every hospital to post their prices without the nonsense of so-called posted prices, and that's not the real price. Have real prices posted so people can know what they will be charged when they go to a doctor, or they need a procedure, or they go into the hospital. And that would drive down prices probably 30, 40, 50, 60%. Who knows? Let the market decide what the price will be for all these services that people want, and people have to determine what are these services valued at, because right now people don't care what the price is because they're not paying for it out of pocket, except for a copay, $15, $20, wherever it is. But it's a sad situation where this is the only area that I know in the economy where people have no idea what the price is of the service that they're getting.
It's insane, because I know whenever I'm talking to friends, one of the first things they are looking for when they're going to a new place of business is the health insurance. They're not even concerned about, do they have access to like a gym, right? Or
Mhm.
something like that. Or, let's turn the conversation towards this personal responsibility, because I think this is where we are lacking wholeheartedly, because your average person has, back to my point from earlier, really abdicated any sense of personal responsibility. They just want to be told what to do, and want to really have those big decisions in their life taken care of. But we really need to go back to fostering this approach of empowering people to be the
Mhm.
best versions of themselves. And that includes the best physical version of yourself. I mean, Dr. Sabrin, I used to weigh 385 pounds,
Oh my
and
goodness.
I was a
Oh,
big boy. And I lost around 180 pounds over the span of about 2 years through just diet and exercise. But I did so because back when at the time I was around 17 or so, and I had a pediatrician who was a family doctor, and she just looked me straight in the eyes and said, Brian, after 10 plus years of being your doctor, I need to tell you that if you don't lose weight, you're putting yourself on a very self-destructive path.
mhm.
And that hit me personally, because number one, it was my home doctor who I knew, and I've seen them for a decade at that point. So I knew that she was saying this out of a kindness of she genuinely cared. But number two, all of a sudden now it put the onus on me. It's not, okay, well, when the time comes that something bad happens, that, well, do I have money to help cover for this? But what can I do to help prevent this? And I think that's where we need to help change the conversation. We have to get people thinking that way. And I think part of it is leading by example, showing that, yes, you can do it. And then to show the other alternatives that are out
Yeah.
there besides the traditional insurance way that we've had things.
This is why I wrote the book, because what I see happening in America is we're going down a road where the obesity levels are going through the roof. The diabetes incidence of diabetes is going through the roof. Heart disease is increasing dramatically. The cancer rates, I think, are in pretty good shape, if I remember correctly, the data that I saw recently. But the point is, as the population ages, the baby boomers, my generation, if you're not in good shape by the time you retire, you're going to be on meds and seeing doctors for most of your retirement. And when in the last years of my parents' life, I went to visit them, and one of their kitchen cabinets looked like a mini pharmacy. And that's the time I wish I'd gone to medical school instead of graduate school, because I would try to figure out what are all these medications doing to them.
Right.
And again, it's a sad situation where doctors are prescribing medication after medication after medication, and we don't know if they know exactly what's going on, if you're going to see 2, 3 doctors for different ailments. And so this is, and that's why the pharmacist is so important, to let people know what the possible interactions are. But the point is, if you don't, let me give you an example. We just moved to Southwest Florida and finally got a hold of a general practitioner. My wife and I visited him last week, and he was amazed that since we're both 74, my wife is on some very minor medication, and I have one medication that I don't consider medication because it's a fish oil. And so he was surprised that we're in such good shape for our age, because I'm sure he sees patients our age who are probably on several medications and have trouble walking, have trouble this and trouble that. And so the point is, like an investment, it bears fruit over the long term. If you take care of yourself over the long term, you're going to be in good shape when it comes to your senior years. And that's one goal I had when I was growing up, is that I want to be healthy in my senior years, because if you have to go to the doctor constantly when you're in retirement, that means you really didn't do the right thing during your adult life in terms of eating right and getting exercise and taking the proper supplements. So again, this comes down to personal responsibility, and unfortunately, given our collectivist statist culture, people think that it's not their responsibility to stay healthy. It's the doctor's responsibility to give them a pill to take care of whatever ailment they have. And that, I think, is a big mistake that a lot of people have made, because again, when you walk around the malls, when you walk around any park or something, it's amazing how many young people are overweight and how many people in their middle years are 50, 100 pounds or more overweight, and they can barely walk. And so this is what's driving up medical costs, because they need a lot of medical attention in order to deal with their ailments. And so because of insurance, those costs are spread across the communities, so they don't feel the brunt of the consequences of their own actions in terms of behaviors that led them to not have a healthy lifestyle. So again, this is not to criticize anybody, but to point out the reality of living, that if you don't take care of your body, and you're the person that's responsible for taking care of your body, and I applaud you, Brian, for taking care of your body to make sure that it's in good shape, because the projections are by 2030, which is not that far away, I think well over 50% of the American adults will be obese. And that has huge implications for medical costs down the future for Medicare and Medicaid. And so, and of course, insurance costs. So we have to do something about changing the culture of the country where people take responsibility for their own well-being.
And I mean, don't even get me started on the mental health aspect, because I can speak to when I was a 385-pound guy, my mental health wasn't the best because it's tough. I mean, yeah, it's a different world when you are that overweight. So there's an entire side section of like healthcare in the mental health aspect that, you know, we could even open up an entire separate episode. But as we kind of go towards, you know, the tail end of the conversation, let's look at the alternative. And this is the challenge I think we have as the free market proponents, is that we have to now come in and essentially replace the incumbent vendor if we're going to go through that business word. So we have right now Medicare, Medicaid, and everybody's favorite, Obamacare. So what can we do to help show that these solutions not only are a viable alternative, but to actually start getting some things in place to almost make these old solutions kind of die off on their own?
Yeah, I think the first thing that can be done is that everyone who is not on Medicare can start putting away money in a health savings account. given that we would need some change in legislation to make those contributions tax deductible, have the funds grow tax free, and having them taken out tax free. So I think we can start there, and that's why I'm trying to reach out to as many talk show hosts like yourself and podcasters, so people would read the book and see the detail that I put into this book in terms of what the transition would look like over the next 5-10 years, because it could be done pretty rapidly. The point is, you need people to buy into the solution, and that's the difficult part. That's why I wrote the book. Here is the reason a free market universal medical care system would be beneficial to the patient and the doctor, particularly the patient, because the patient is the recipient of the service. And what do we know in business? There are two rules. One, the customer is always right, and rule two, see rule number one. That means doctors have to be sensitive to what their patients need and want in order to get to optimal health, and they have to explain things to them. That's why I use traditional doctors, and I have a longtime friend who's a naturopath, and I see him for advice also. I recently spoke to him about certain things that we want to address in our family, and he was forthcoming and available. So there are ways of getting to where we want to be in terms of optimal health. I don't know anyone who doesn't want optimal health. The question is, how do you get there? And of course, a single payer government system is not the answer. One of the doctors I interviewed for the book is a former Canadian doctor who believed in the single payer government system in Canada. Then when he started practicing in it, he said, this is not patient friendly. This is not patient oriented. It's all about meeting the budget of the provinces. And so he's now practicing in the United States as a radiologist. And he said the Canadian system nearly killed his brother. And so therefore he is very skeptical of the Canadian system. And he applauded me for writing this book as a blueprint. Remember, blueprints are not the final say in a building. It has to be changed and adapted. So I think I've created a blueprint that we can at least discuss and debate in this country as to where we should be going in terms of medical care. Instead, the Biden administration is expanding Medicare, is expanding Medicaid, which is the wrong approach. What that means is the people will be more dependent upon the government. And one of the themes of the book is financial independence. I don't know any adult who grows up and says, I want to be financially dependent. But the point is, we have a system where implicitly people are financially dependent on Medicare, Medicaid, Social Security, which is a whole nother topic. But the point is, I've always stressed this in my writings for the past 40 years. We need to have a culture of financial independence. And we have the nonprofit sector to help people who can't help themselves or don't have enough income in the free market. That's the beauty of America. The volunteer sector is one of the largest sectors in our economy, and I want to see it thrive and flourish. And then chapter 1 in the book talks about the welfare state and the nonprofit sector. And I have a whole chapter on the nonprofit sector. So all the things are interrelated. The nonprofit sector is a free market approach to helping people who are in situations where they don't have enough income to meet their needs. And that's been true throughout American history. The mutual aid societies before the Great Depression were thriving. And so I want to resurrect that culture, that value in America. And this book, I hope, can do that. And that's why I want all libertarians to buy not only one book, but buy several copies, especially the Kindle edition, which generates a lot of royalties for me, which will be used to support free market educational organizations like the Mises Institute and the Ron Paul Institute, and nonprofit health centers. And I support 3 of them in New Jersey. Now that we're in Florida, I hope to support some in Florida. So this book will give me, hopefully, the resources to leverage the value and the ideals of a free market system into medicine that will make this country a much better country for the 330 million Americans who want to have good medical care at affordable prices.
So we have some action items because I'm a sales guy and I got to put the action items down. They are number 1, folks. If you're interested in learning more about HSAs, I did an entire interview with Dean Clancy. He was I think it was Bush, Reagan, I forget. He was one of their top policy advisors, but he's also a former VP of Freedom Works. He's leading HSAs for all. That's his big focus right now. I think he's working with Rand Paul in the Senate. So that's action item number 1. Action item number 2, tell the stories of people who have faced socialized or universal health care from a single payer system. Tell their stories. And I appreciate you bringing up your friend from Canada story, because I think we need to tell more of those horror stories about what happens when you get what you want. And that is this single payer system. So that's number 2. And then the final thing, buy the book, buy this freaking book, Universal Medical Care from Conception to End of Life by Dr. Murray Sabrin. It is, I can't stress enough, so important for us to make sure, just like our friends over at the Sound Mind Creative Group who are doing their awesome docuseries, Follow the Science on Lockdowns and Liberty, it's on us to make sure that we're effectively, and I would say in many cases, for the first time for people, setting the narrative and showing them how we can do this, that you don't need to have nanny state government hold your hand in order to live a healthy life, but rather you just take a little bit more time to TLC, tender love and care yourself, and focus on making yourself a better person. I think you're going to be in a better spot. So that being said, Dr. Murray Sabrin, with that, folks, obviously we want to make sure we can lead them to the book. I will include the link to the book in the show notes, but where can folks go ahead and follow you? They want to keep up the conversation.
Well, what I'm going to be doing, since I'm starting to work on my next book, I won't be writing as much as I otherwise would on my blog, murraysabrin.com. I'll be posting all the great interviews I've had. I had one with Ron Paul last week. That's linked on my blog. And I just hope that people realize that ever since I decided that libertarianism was the way to organize society back in the 1970s, I was hoping that there would be one libertarian book that would be a game changer for the country. I don't know if this is the one, but I'm hoping it is, because with the royalties that the book can generate, I think we can leverage that to get our message out, so hundreds and hundreds of millions of Americans, which is over 300 million today, will understand that freedom and liberty are our birthright, that medical care is something we should strive for in the free market. So we the people, determine what medical care should be and how much it should cost, because ultimately the consumer determines what the price is in a free market. People don't understand that. The politicians don't understand it. Most conventional economists don't understand it. And so by getting this book out into the general public, we can start a national conversation. One thing I'd love to do is debate Bernie Sanders, single payer system government or single payer system individual or family. That's the debate we should have in this country, not how much Medicare should expand or how much Medicaid should expand, but whether we should have a single payer government system, which is what he wants, or a single payer individual family system, which is what free loving people want to have, where we are in charge of not only our medical care, but everything else in life, so that we do have the blessings of liberty, we do have prosperity, sustainable prosperity, and we can all live in social harmony instead of this backbiting that's going on today because of this contentious issue with COVID and the lockdowns and all the other things that's come about because of top-down approach to medical care.
Well, you said you're hoping this might be the libertarian book. Well, I know one Dr. Ron Paul gave it his seal of approval, so I dare say you're on the right path if Dr. Paul thinks that this is, in fact, the book. So with that being said, we will include all the links to not only the amazing universal medical care from conception to end of life in the show notes, but also all the links you can go ahead and follow all that Dr. Sabrin's going to be doing. But with that being said, Dr. Murray Sabrin, thank you for joining us today on The Brian Nichols Show.
Thank you, Brian. This was a great opportunity, and I really appreciate you giving me the time to explain how we can get from here to closer to a free market economy in the near future.
Alrighty, folks, that's going to wrap up my conversation with Dr. Murray Sabrin. What an awesome conversation. If you want to go ahead and make sure you get the book, I will include the link in the show notes. All you have to do, go to your little podcast catcher, click the artwork for the Brian Nichols Show. It will bring you right to the website as well as to our episodes page. Click on the episode. You can not only find Dr. Sabrin's links, you'll also find a transcript for the show as well as today's sponsor. So make sure you go ahead and give them some love. You enjoyed the episode? Well, please do me a solid. Please share the episode. Make sure you let Dr. Sabrin know you enjoyed the episode. Make sure when you share it, you tag yours truly at B Nichols Liberty. Otherwise, that's all I have for you today, folks. Coming up here on Saturday, I still got to get used to the whole Saturday thing, but yes, we are having one good friend of the show, and he's an assembly candidate running in New Jersey, Nicholas Magner. He's returning to the program for a one-on-one with you guys, but he's heading down to Washington, D.C., and he's going to be taking part in the End the Damn Wars, I think it is, rally taking place down there on September 11th, talking about why it's time to end these gosh darn wars. So, with that being said, folks, make sure you've hit that subscribe button so you're not missing a single time a brand new episode of The Brian Nichols Show, yes, drops daily. But with that being said, it's Brian Nichols signing off here on The Brian Nichols Show for Dr. Murray Sabrin. We'll see you tomorrow.
Thanks for listening to The Brian Nichols Show. Find more episodes at briannicholsshow.com.